Welcome back to Live at 9. An estimated 20 million Americans have some form of thyroid disease, while up to 60% of those with thyroid disease are unaware of their condition. That small butterfly-shaped gland has a big job, and many people don't even know what it is, where it is, or even what it does. Well, to answer those questions and more, we're joined by Dr. Tracy Bruin, a clinical associate professor of the College of Health Sciences at the University of Memphis. So for starters, what is it? Now, we said the butterfly shape. Where's it located, and what is it, and what does it do?
So the thyroid is a butterfly-shaped gland located right here in the middle of your neck, and that is that if you're at the doctor's office and they tell you to swallow, that's what they're feeling for. And this little tiny gland is kind of the powerhouse of metabolism in your body. So it's primarily responsible for regulating your metabolism as well as temperature in the body. And so it's controlled. The main nutrient that actually influences the thyroid is iodine. And so it's just a very small amount of this trace mineral is needed, about 150 micrograms a day for most people to keep the thyroid healthy.
And when it becomes swollen, what's that an indication of?
So when your thyroid becomes swollen, this affects more women than men too, I should mention. And for most women in the postmenopausal age. And so once the thyroid becomes swollen, this can be an indication of either hypothyroidism or hyperthyroidism. Those
What's
are
the
two
difference
primary.
between the two?
So with hypothyroidism, typically you have symptoms of fatigue, you may have constipation, you may have unintended weight gain, whereas with hyperthyroidism, this is more like hypermetabolism. So you may have unintended weight loss, you're more at risk for bone disease and loss of muscle mass.
So, I mean, you're really not going to know until you're at the doctor's unless you're not feeling well and you're just like, hey, can you check my thyroid?
Right. You may have symptoms that are coming on, but a lot of those can be confused with other symptoms, right? Especially for women when they hit that postmenopausal age. We may all start to feel just chronic fatigue, and we may slough that off as to, I'm just getting older. Maybe I haven't been working out or watching my diet as much as I should have, but that's why it's so important to have that screened at your regular appointments.
And when it comes to food intake, what is the best foods that could keep this healthy, and what foods should we stay away from?
So for keeping your thyroid healthy, there's several minerals that we need to include in our diet on a daily basis. So I mentioned iodine, but there are other trace elements, selenium, which we find in the Brazil nut, the biggest nut in that mixed
Yes.
package of nuts. Also in some seafood. Those help activate your thyroid hormones from inactive to active in the body. Other important nutrients may be iron, which we find in our red meat and dark green leafy vegetables. Also, we need vitamin D as well to help activate those thyroid hormones. So we find vitamin D, of course, in our dairy products.
What if you don't eat meat, though?
So if you don't eat meat, then you can get your vitamin D from a little bit of the sunshine. So 10 minutes outdoors of exposure.
And then when it comes to iron, what if you have a low iron deficiency? Is that going to become a problem? Well, clearly, but like...
Yes. So you need to include, definitely, if you don't eat meat, then you can include sources of beans, legumes in the diet, and combine that with dark green leafy vegetables and a source of vitamin C to help with your iron absorption, so that you can maximize that.
So are there foods that we need to stay away from? Because is it genetic when you have an issue when it comes to your thyroid, or could it be an environmental issue?
So you can have a little bit of all of those. So we do have things like Hashimoto's and Graves' disease, which are autoimmune and genetic. And then we can have exposure to environmental toxins in our lifetime that may make us more prone to disorders with our thyroid, or it may be something like with thyroid cancer later on coming on in life. And so there are some foods that the population feels that we need to avoid, but those foods are called cruciferous vegetables, or broccoli and cauliflower.
Which you think is like, you're supposed to eat broccoli, but not raw?
These are our powerhouse foods.
Right.
Yes, so that's the key. So you don't have to avoid them all together. We just want to be sure that we cook our broccoli, our cabbage, and our cauliflower, because the heating of the food will help decrease the effect of the absorption in the body. So you would have to eat a lot of raw broccoli, cauliflower, and cabbage to block the absorption of iodine, which would affect your thyroid. So most of us in America, we barely eat 1 cup of broccoli a day, I would guess. So I don't want anybody to give up broccoli or cabbage or cauliflower. Just be sure you cook and season it well.
And when it comes to taking medication, does that have an issue when it comes to your thyroids? Is there an absorption issue when it comes to taking certain medications, or is it everything okay?
No, that you bring up a great point there. So when you're taking your thyroid medication, it's best to allow for 2 hours. Take your thyroid medication 2 hours before you eat or 2 hours after you eat, so that those, if you are including any of those vegetables that might decrease the maximum absorption of your thyroid medication, like the broccoli, cabbage, or cauliflower, then you're going to avoid that. So it's best to take thyroid medications on an empty stomach.
Do they tell you that at the doctor's office?
Now, I would hope so,
I think that's important.
We find this, or at least I found this in my career, a lot of times maybe there's not the time to spend on discussing nutrition within your doctor's appointment. So reach out and find and ask for a referral to a registered dietitian. We have many in the Memphis area that'd be happy to help.
And then last question, if you're walking into your doctor's office and you think like you have a thyroid issue, what terminology should you say to your doctor?
I would say, I think there's something wrong with my thyroid. Could we check it? I've noticed that I've had onset of unintended weight gain or weight loss, and I'm concerned about my health. I think we have to be our own best advocate.
Absolutely. Thank you so much for the fantastic information and advice. What we should eat, what we should stay away from, and all the reason why it's so important, because if it regulates our temperature and our metabolism, that's crucial to the whole body.
Oh, absolutely. Yeah. Absolutely. Keep us going.
Thank you.
Thank you for having me. I appreciate it.
Well, coming up next, our Loving Local series continues with the inspiration behind Dance Like a Cupcake. We will talk to the founder and see what separates her creations from others.